We decided that to go more on the experiential route for our panels to really highlight more firsthand and what we've gone through as veterans, and also how we're transforming the experiences that we've had in the military and associated trauma that
I was actually deployed attached to a military police unit, and part of my job was, as well as HR, casualty assistance. And so that was a very difficult thing, sending your dead brothers back home.
Next we have finally Mike Cooley, who's also Brooke's husband, and was an E5 in the military and was one of the leads in the military police with the K9 handler unit, right?
We always joked that military police were like infantry with trucks. We got to drive to where we were going to assault instead of walking. And so a lot of the same things that Matt went through, I went through as well. And in addition, I was a canine handler for a number of years while I was worked in explosive detector dogs.
So we walked throughout Iraq looking for things that would blow up and trying to stop them.
So what I'm going to have us do is kind of dive in experientially into maybe a poignant area that we have been working with in our own traumatic backgrounds that's impacted by trauma. And what I would encourage you all to also listen in terms of, this is not unique to the military. I mean, there's so many relatable traumatic issues that we have that's in the military that also happens in civilian life. And similarly so, with this particular journey of work in this path, there is so many levels that we're addressing in terms of obviously what's happening neurobiologically, how that's impacting the system, the spiritual component that's actually intertwined with, there's often said that we have a fracturing or splintering of the soul when we go through extreme trauma, and there's a part that leaves or does not come back with us. So there's that component that we're also looking into kind of integrating with this experience. And equally important is the setting and the setter in these times of therapeutic environments that we're utilizing the medicine to be able to shift, change, and reintegrate in a sustainable way the impact that it has for us. So I kind of give you that little bit of that background just as a kind of a backdrop to listen in as we engage with you about what we've gone through and what the transformation has been in this journey of healing. Okay, so Ian, I'm going to have you start with your background. And I would also like to also highlight one of the things that we don't know, and it's also known in the medical community, that almost 70% of our military forces are usually have had some type of traumatic childhood experience or home environment that's been very traumatic, that often we seek refuge in the military. So there is a predisposition to having already had trauma and then being more predisposed to being more impacted by trauma while we're in the military. So sometimes the camouflage of the trauma that we have within is in the military setting is often covering up what we've had before we even got in. So I want to also kind of highlight that, because that's not something that's unique to just being in the military, but something that we all, have faced one way or another in different capacities, and it's not one setting or another. Okay, so Ian, if you would like to expand on your experiences.
Sure. Well, for my life, seeking out new skills and capabilities has been a coping mechanism to deal with the trauma without realizing that that's what I was doing to start. And when I don't have trauma from combat. I wasn't in Iraq or Afghanistan. I have trauma from flying a helicopter and that responsibility, that burden upon me, but not from the actual service. But I have childhood sexual trauma and members of my family dying. And when I started to dive back into this medicine work 3 years ago with ayahuasca, I remember on the second day of ceremony, the medicine was polishing my heart and cleaning it out and then putting it, blowing it up and then putting it back together. And after that went on for a while, I said, I'm ready to take this thing out for a ride. Let's see what this can do. And I went straight to this first sexual trauma where I was being sodomized in my own house by this boy in the neighborhood. And I was just blown away that I could have this I'm like, is this time travel? Is this, what's actually happening here? And After focusing on myself in that role as a victim at the initial outset of the interaction, I then shifted to have compassion and empathy for this other person and realized that this isn't occurring in a vacuum. There's something behind this. And when my empathy and compassion shifted towards him, I'm like, why are you doing this? Not a challenging, but why is this happening? Why are you participating in this? The whole experience just completely evaporated, and in my heart opening up, it allowed me to let go that claim or action against him, and I got healing from it. So for me, this has been a real pathway for healing my childhood and life traumas, separate from any real, specific military traumas.
Great. And I think, one of the things that, as we spent a good bit of time prior to the panel really kind of delving into our own history and work with the medicine. And I think what, Ian is certainly highlighting that there is a bit of perspective that happens when you get into working and dealing with what the issue might be. But and Ian's done a lot of work as, actually as Gabor, I hope I'm pronouncing his name right, Gabor pointed out that it actually shifts your perspective on maybe what we're going through, and it's so important to do the work afterwards. And so there's been a lot of integrating and a spiritual practice of work in terms of being able to understand what happened and be able to hold that felt sense, right, and the experience and knowingness that it's not just something that was a kind of a movie in one's own mind, but it actually informs his present-day reality and the way he engages. Would you say your relationships with yourself and with your family has changed in any capacity?
Yeah, absolutely. I remember someone at ceremony recently said, "Oh, how do your animals respond to you after you take ayahuasca?" And I'm like, "Well, I'm less of an asshole, so I guess they appreciate that." But really, in my family, it's been vulnerability and communication, transparency. So issues that would normally maybe just get put on autopilot, overlooked, ignored, there's a greater intensity and desire to address those immediately with vulnerability to really get to what's really going on, communicate, and then move on. So, yeah, there's less buildup of friction and tension because there's a more move to bring that stuff out and get greater understanding as we're going. And so, yes, it just makes my family life easier is ultimately the difference that my family sees from the work.
Right. Thank you, Ian. And Matt, if you share with us a highlight from, I think we had talked a little bit about what your professional experience had been.
In the infantry, there's plenty of trauma to go around. Buses full of dead women, children, elderly people, burnt out vehicles, charred bodies. War can be indiscriminate sometimes, and it's not easy. There's a great sense of loss and harm to oneself when you perpetrate acts that there's so much torture and loss of life. There was certainly a lot to unpack after I got out of the service. So it took me a couple years just to realize that cannabis might be an option to get off the pharmaceuticals. I'm one of those veterans that was on 20 medications every month. It was obscene, honestly. Opiates, benzos together, large quantities, 160 milligrams of OxyContin, roxicodone for breakthrough pain. There was Xanax, there was Valium. I was medevaced from my second deployment, and I came home with a lot of injuries. And there were, after you separate from the service, there's also a sense of loss there too. You lose your team, you lose your mission, you lose everything that you thought you were. And ayahuasca and the other indole alkylamine bearing plants have taught me that I'm no longer a soldier. I'm not just an infantryman. I'm not just I'm not just a man. I'm a human being, and it's taught me how to be a human being again.
Thank you, Matt. And I think one of the things that that kind of is underlying some of our work, unfortunately, in the military, sometimes we're not just always the victims of trauma, we're the perpetrators as well. So there is a moral injury, as we would call it, that happens when you're forced into doing things that may not be in alignment at all with your values of, or moral being of how you would want to act. And living with that is also a type of trauma that's very hard to shake and make meaning of. And I think some of the journeying work that we've been able to do in the capacity with this medicine is actually giving, again, another level of meaning and perspective on why and what happened, and to be able to integrate that within the tissues of the body. I mean, sometimes I tell my patients, your issues are in your tissues. I mean, it may not be in your brain and your mind all the time about what's going on, but your body's holding on to it. And so with Matt's experience, it sounds to me that, you know, being able to transform that pain and be able to hold it differently and not be identified constantly with that kind of circulatory kind of way that we think about this issue, and it just perseverates in our brain and in our body. So I think, would you say that it's been shifted out of your daily makeup?
Absolutely. It's changed my life completely. Whether it's cannabis, which is usually the way that most veterans get off of the medications, eventually you get to a point where that's not enough. It's a Band-Aid that covers up a spiritual wound, and you have to figure out what is the spiritual wound that you have to heal from. And the pharmaceuticals are just bandages on top of it. Cannabis is also a Band-Aid, but it's the best one we have. It's the safest by far. Eventually you have to actually rip the bandages off. That wound is festering in your heart, and you have to clean it out. You have to actually throw some alcohol and hydrogen peroxide in there, and you have to put stitches and literally stitch up your heart. And that's why I call ayahuasca stitches for the soul.
Thank you, Matt. Thanks. So Brooke, could you also share with us one of your...
I came back from my deployment, and I was addicted to opiates when I came back. I was deployed for 2 weeks, just the first 2 weeks I was there. I had had an umbilical hernia repair done before we left, and I was told not to carry more than 15 pounds for 6 weeks. And we left for Iraq 2 weeks later. And your body armor weighs a bit more than 15 pounds. So my hernia opened back up, and I stayed on pain meds pretty much the entire time I was deployed. It did a great job of numbing out physical pain, but it will also numb out all of the emotional stuff that you have going on right then as well. I was a single parent at the time. I had a 4-month-old daughter that I left. That causes a lot of guilt. So opiates are great for not feeling anything. And then I came back, and they repaired my hernia, and they took away my happy pills, and I developed a raging addiction. Methamphetamines, cocaine, anything I could get my hands on. I was also one of the soldiers who had been given opioids, benzos, all the psych meds you can name, Seroquel, all the fun stuff. And you literally, I did 3 inpatient psych holds, became suicidal twice, had to go to the hospital 3 times. And when I finally was able to get off the medications using cannabis, that was a huge help. That was massive. That started to show me that this can change. My husband went and did ayahuasca, and then I was given the opportunity to do guided MDMA as well. And it was life-changing. To be able to thank the person, that soldier that you were, and the one that kept you alive in a combat zone, and then be able to mesh that with the person you know you still have inside of you. You just have to be able to find her. To be able to do that under the MDMA was absolutely transformational for me.
Thank you, Brooke. Brooke's also highlighted to some degree of the different personality types or different beings that we are aware of, that we can be in different capacities and in different environments or situations. And one thing that I've noticed in our engagement about her process is that one of the things that it seems to be more there is actually to be able to choose which role that she's going to be in, to have that choice to respond as opposed to react, to have more of a consciousness, awareness to where she has played a certain role, but not necessarily having to completely identify with that, and having compassion. Would you say, Brooke, that that's something that has developed for you in the self-compassion and for yourself and others? Absolutely.
Prior to the hypervigilance, the anger that you carry coming back from a deployment that PTSD locks onto, to be able to have the choice, I can wake up today and I can be the biggest ass on the face of the planet, or I can wake up today and I'm okay. I can take these steps forward. I can take care of my kids today. I can choose to be more nurturing. I can choose to be more compassionate. It is a conscious choice now, whereas before, I don't believe it was.
And one of the things also, if I may also ask you to kind of elaborate on a little bit, is that sense of feeling again, right? In terms of not feeling just robotic and a utilitarian, that you had to do this to be able to survive with your children and at home. But can you speak a little bit about that alive feeling that's come back in your life?
To be able to feel love. You have to be able to love yourself. They always say you have to love yourself in order to feel love and be able to give love out. And you know, you think that you love yourself, you think you're doing that, and then you realize you're not. And so the medications, the medicines that I have done have helped me to come back to being able to love myself, so that I can give that to my children, so that I can show that to my husband without just completely walling off emotionally.
Great. And that sustainably?
Absolutely. The more that we delve into the medicines, the more that we continue to use them, the more that we're seeing this is very sustainable. This is something that can continue to carry on, and you don't really backslide like you think you would. It doesn't happen that much.
Great. Thank you, Brooke. Thanks. Okay, so Mike, if you would please share with us. Thank you.
When I joined the military, I joined because of 9/11. I joined because I wanted to fight for my country that was broken and in pain. And in doing so, I guess at the time naively realized that I had to set my humanity aside in order to become the role of what I had to do and what I had to be. And I didn't realize at the time the gravity of that decision, assuming that role of someone who was trained to take other people's lives without hesitation. And it stripped me completely bare. And I stopped caring about other people. I stopped caring about myself. I didn't care about life. Nothing mattered. I was just accomplishing the mission, and that was what mattered. And as time wore on, that lack of humanity started to wear on my lifestyle. I distanced my family. I distanced everyone that I cared about. And I just kind of became this shell of a person. and I didn't even realize it. I thought that I was completely normal because everybody around me was exactly the same way. So we're all normal in our completely screwed up ways. And then I had a break when I met Brooke. When I met my wife, Brooke, I had a break. I was sent to Germany away from her and away from my family, and that distance really helped me to see where I was as a person for the first time in my career in the military. Everything that I thought that I had been doing good up until that point stopped mattering. All the awards that I had received, all the accommodations, all the congratulations, the coins, none of it mattered anymore. I was away from my family, and it started to eat at me, and I ended up being medically retired and sent back to the United States, and it was there that my anger started coming out. That I started acting upon the feelings that I was feeling under the surface, and it started breaking everything apart even further. But I saw through the healing that Brooke was making on cannabis, she was out of the military before I was, and she began healing with cannabis, and I started seeing that shift. And so when I was retired, I immediately went to cannabis, and I thought, you know, I've seen what this is doing. I've seen the medications that she's come off of. I've seen the change in her life, and that was testament enough to me, even as a military police officer who had enforced cannabis. No, I mean, it's the devil to the military. It makes you want to not fight. We're not having any of that. And it allowed me to soften. It allowed me to realize that anger and that rage and that hatred was not a core of who I was. It was a part of the personality that I had taken on, and that it was not conducive to my life anymore. And I needed to let go of it. And as Matt said, it was a Band-Aid. It allowed me to get off of the pharmaceuticals, and it allowed me to exist somewhat better. But it was ayahuasca that completely cracked my heart open and showed me that I could care and that I could love and that I could love myself. And the healing just continued from there.
Thank you, Mike. One of the things that you and I had also spoken about in terms of going through the experiences that you've had and ways that you've either known directly or accidentally became aware of maybe some of the actions that have been, some of the results of your actions in the military that were very traumatizing to hold on to for your own knowing experience of what you might have done and might have not willingly have done. And is there an area that you can kind of highlight for us how the medicine work has transformed that for you in ways that it doesn't grip you every day? And part of the anger that we discussed too stems from that, right? In ways that's, there's not anything you can do to go back and fix it. There's not anything you can do to maybe even repair it. We don't even know where some of these people are that might have been affected. But how do you move forward with that, with the journeying work that you've done with this medicinal approach?
It's very easy to recall certain memories at times, pivotal moments that really changed my psyche. And I remember driving out of the gate of one of our bases, and my team leader turned to me and my gunner. I was the driver of the Humvee we had in our squad. And he turned to us and he said, "From here on out, you may as well consider yourself dead, because that's going to make it easier for you to do and see everything that you're going to from this point on." So just assume that you are dead from this point forward. And it was a mental shift. It was that release of that humanity. What these plant medicines have shown me is that that's exactly what it was. It was a mental shift. It was a release. And that same mental shift is brought about in the opposite direction by the plant medicines. They show me that I'm alive and that I'm a part of everything, that love is a part of everything, that I can distance myself from that story of who I was in the past. I was there, I saw those things, I did those things. They are in the past, however, and that is not who I am now. And I can see that distinction, and I can not be gripped and swallowed by that anger and self-hatred and pain of everything that I did and everything that I experienced. But I can now look back and I can use that as a story, looking at it from a third-person perspective, and use that to show others why that path is so wrong, why that path is so dehumanizing to our youth and our men and women that we send to fight these wars, and that there needs to be a better solution. There needs to be a better way than dehumanizing our people and our children and our loved ones.
Thank you, Mike. One of the things that's, is striking coming from a medical perspective too, we don't often talk about immersing ourselves in love or connecting deeply with the spirit. I would like to, obviously, since I'd been a Hindu nun before I came in the military, but I had to practice also a covert mission of compassion. We don't talk about being compassionate. We do talk about, fighting the fight. And again, it's somewhat unique to the military, but also in life, there's a lot of times of being, whether you're in the military or not, we have our own demons that we're fighting internally and externally. And I think one of the things that's been so profound with this work on a therapeutic medical level, it has shifted the felt sense internally of what it means to feel connected on a higher level, what it means to feel loved within and be connected to a bigger community that we don't even sometimes realize is out there. And isolation is often one of the unfortunate side effects of having a traumatic experience. We isolate and think we're alone. We're actually sitting in our own internal cave thinking no one will be able to understand or relate. And also the beauty of some of this type of path of work is also the community that seems to be evolving around supporting and healing with each other. As has been highlighted a little bit before, I think it's very, very important that we also stress how important it is to integrate the experiences and the insights and the messages that might have come through that's beyond just words. And what I'd like to do is maybe just in a round robin style, whoever would like to speak up, is if you could just touch a little bit on how you've been able to integrate and make this a part of a daily engagement for you rather than it just being either gone into a therapeutic environment or even watching an internal movie, which sometimes is an escape if we use that in that form, which sometimes in a recreational way it can be. However, bringing it back into a really, truly transformative therapeutic tool in some ways, how have you been able to, what are maybe some of your practices that you do to integrate this back into your life?
Sure, I'd love to quote one of my heroes, Houston Smith, who said that the goal of the mystical experience is altered traits, not altered states. And it's, you're only as good as what you can bring back from these experiences, like the movie metaphor or going to church and hearing a great sermon and then not being able to do anything with it. So I've had a spiritual practice for this whole time. I've been on the medicine path over 25 years, and having that daily practice is really key to create the mindfulness space, to do the reflection, and to do the assimilation, the integration, the inculcation. As you're letting things go, you're putting things more grounded. And I think that's what I found in this work is ideally you have a sponsor that can take you to the medicine who shares your experience, background experience, whether that's being a veteran or something else, first responder, who sat with the medicine, who's taken it, who's going to be there for you as a sponsor. And then afterwards, when you're doing your own reintegration, the ability to have that support system of other people who've gone through this process, who experienced the medicine and can tell you that you're okay and you're not crazy and help you, to continue your work. I think that's really, really key.
Right. Thank you, Ian. Anybody else?
I think reintegration is probably the number one topic that should really be talked about with psychedelics in general. If you don't do the work in your regular everyday life, you're not going to get anything out of it. You only get out what you put in, and you reap what you sow. So you have to start making huge life changes, and it happens one step at a time. But it's really taught me the importance of other things. We need to really broaden what we believe medicine to be, because my veteran brothers and sisters, they're my medicine. Their love, their support, their help. Nature is medicine. Exercise is medicine. Life is medicine. And the good thing about life is you can always increase the dose. So, teaching people with PTSD, with these dysfunctions, to learn to enjoy life again and participate in it more fully is really the goal. So I've really incorporated a lot of those things into my life. The community, I had to build a community from scratch of veterans who believe the same things I do and want to change the world like I do. That has been an enormous help, the community aspect. And then, of course, the nature. Communing with nature is huge, and it's something that a lot of people find is particularly useful when under the influence of psychedelics, but also in your everyday life. Get out there and see what it is to be alive, to be a human being on this planet. Experience those things. And relationships. That's a huge one. Building relationships. Because when I came back, I didn't have a relationship with anyone, not even myself. I was lost. And I was lost to the point that I didn't believe I should live. I tried to commit suicide twice because I thought I would never be anything but a killer. And you have to chop off all of your ties to everyone else in the world in order to think like that. You have to change who you are inside, and I had to unlearn that and teach myself to not only love myself, but to forgive myself. Forgive myself for all the things that I've done, and forgive everyone else for everything that they've done to me too, and begin to build those bridges towards other people, towards community, towards family.
Thank you, Matt. That's great. In the interest of time, let's see, how much time do we have, Brad? It's Brad, right? Oh, okay, we still have good time. Okay. So I think, Mike or Brooke, did you want to mention anything in terms of the reintegration process for you both?
I think for both of us, it was kind of an interesting situation just because we are married and we live together, and that can be a great thing, but it can also be a very complicated thing. We had to learn to speak. We had to learn to be able to talk to each other without handing out orders to each other. And that took a lot of patience, which is not my strong suit. So we did. We had to do a lot of talking. We had to open up. We had to discuss things that were painful. We had to discuss things that we didn't even want to have the conversation with ourselves in our own heads, let alone have to say it out loud. And for us, the reintegration, coming back and integrating back into your life after these huge changes have happened, for us, it was, the communication piece was absolutely vital.
Absolutely. Yeah. Absolutely. It for veterans or for anyone with trauma that is using these plant medicines, that reintegration, I can't stress it enough. I mean, everybody on this panel is talking about it because it's so important. How do you take what you have learned in the matter of a few hours or even less than an hour that has completely shifted your entire perspective on everything that you thought that you knew about everything, and now what do you do with that? And for me, coming back from my first ayahuasca experience, I did what you should not do. And I was told little drops, and I opened the floodgates, and we almost divorced because of it. Because I was healing, but I had left a household that was not experiencing any of that healing. And I came back into it going, let's heal. I'm ready. Let's go.
That's not how it works.
There were years of trauma and pain to be dealt with and to be healed slowly and compassionately, and I needed that reminder that just because I had been given this glimpse, nobody else had. And that experience I needed to let settle and build on it and understand it before I came hard charging trying to tell everybody it was time to change. But that comes with experience of the plant medicines. It comes with that integration, that reintegration, talking with people who have experienced it before that can say, whoa, congratulations, that's awesome. Now let's sit down and let's talk about how you're going to plan out what you're going to do with this.
Thank you, Mike. Yeah, I think one of the things that those have gone down that path, I think there's an initial euphoria that usually can be there with certain types of the medication and certain paths. And I think, as you know, Mike is pointing out, it's really to be able to view that also as an experience, and also making sure that we're gleaning the insight or the transformation that's happening without also jarring the environment and the relationships that we're in because of almost a messiah feeling that we've come back with. And so as much as we feel it's very important to hold on and embody that, there is the everyday reality that we're engaged with that is not having that similar experience with us. But we do inform it. And I think the beauty of the work that I, as a medical doctor, also am seeing in so many ways of the transformation that's happening on the intrapersonal with oneself and the interpersonal with one's community, with one's home environment, work environment. It's powerful. It's not something that one can deny, that there is something there that is making these shifts happen that's actually sustainable with the work that comes post the medicine work, but living in this reality and bringing back the information that was given, the insights that were found, and also the experiential aspects of what it feels to be in this body as a spirit, as a mind, as a physiological being, and integrate all of that back into your daily living with knowing that we were working on areas that have been holding us back from fully living because of some of the traumatic experiences that might be there that are holding us from actually engaging with life. So I say this also with pain, in terms of physical pain and emotional pain. There's a very much of a hand-in-hand relationship that we are more and more willing to notice in our medical community, that it's very much on a continuum. So when we're having physical pain, there is an emotional component to it that we may not be acknowledging, Or when there's intense emotional pain, it can actually ripple into being physical pain in the body. And it can actually manifest in other disease processes or disorders that we want to, again, separate in the Western way of doing the medical work that we compartmentalize. And as I've evolved also in my medical practice, I actually kind of joke and I want to open up a love clinic. So anybody that would like to join our love clinic would be welcome on all dimensions. And then I want to also extend this. This is, we are being able to have a forum to speak about this as a military veteran community, knowing that our traumas and our plight often is highlighted more so in the news because of what we have done for a living or in the environments that we've been in. But it does not minimize in any form or fashion what other non-military folks have gone through in their lives that are also experiencing very similar states of being and trauma that might be holding one's own progress in life. So I want to also come back to that there is a real sense of mission, repurposing, kind of a higher feeling of going back into being in your own calling that kind of comes through with this journey of work and this medicinal kind of transformation that happens, especially when those are feeling the existential frustration of why am I doing what I'm doing, and especially those of us that have been involved in a very high mission-oriented type of work. When we've come back out into the civilian sector, there's not much of that drive, but then it becomes a purpose-driven life that has also started to evolve with this work. So I would like to also open it up for questions, but I would say is that, if you have general questions about the work itself, not too specific on where and who, but more on anything that would be helpful and informative for yourself as a person and also the community at large. Okay, so if there's a mic that we can pass around.
Well, first of all, I'm going to make, so for questions, if we can form lines on this aisle and this aisle, I think it'll make it a little easier. So just walk down here if you want a question. And I don't know if you mentioned shock and awe. Did you mention that?
Oh, no, we didn't actually. Do you want to, you probably have a little bit more of the background. Or is there actually one of you guys, do you want to mention the movie?
Yeah, actually, From Shock to Awe is a film that was just released at Illuminate Film Festival in Sedona, Arizona. It's won some awards already, doing very well. Janine Sagert and Lou Cote, they put that movie together. It was a labor of love for 3 years, and they followed us for almost the entire time. If you would like to get a glimpse of what From Shock to Awe has to offer, it is going to be screened, at least a small portion, at 7:30 tonight.
Yeah. So it's 20 minutes of the hour and a half film?
Yeah, about 20-minute version.
Okay, great.
And that'll be right in here. So make sure you come back for that. And I also want to mention, please try to keep it quiet in the back there because it's a little disruptive, and just to be courteous. So, the first question.
Thank you for a very powerful presentation. I didn't go into the military. I lived through the Vietnam era, though, and I faced psychological child abuse. I grew up to be an immigration lawyer, and this past week has been eye-opening for the country in terms of the feared psychological damage and health damage to children. I've known about this kind of condition for my 40-year career, and I've been somewhat inured to it, but I didn't realize until I heard psychiatrists and pediatricians being quoted in the press and on television, the damage that it could cause. And so this is bringing up things in me, and I guess I just would ask you, how do you go about finding a sponsor to help you in this journey?
Come to conferences like this, Terrence McKenna always used to say, it's great that you're here, for the people that are speaking, but it's really the people that you're going to meet in the audience, and everybody you need to meet is here today. So that's what I'd say.
And there are physicians like myself and others in the community that are doing it on a medical, clinical level that you can be in touch with as well.
Yeah, go for it.
Just use your military voice, please.
After experience, not just what you experience as far as trauma, but after also experiencing ayahuasca, if I was wondering if you could share a little bit if there's been a perspective or feeling shift regarding the purpose and necessity of military in the war. Like nowadays, how do you feel about the purpose and necessity of military in the war?
Absolutely.
Repeat the question, too.
Okay, so she's asking about how we feel now after experiencing ayahuasca and other psychedelic medicines, how we feel about the institution of war and the necessity of it. And I honestly think it's veterans who have to come back to society. We've lived it. We know how horrible it is, and it's up to us to teach society, our society, to transcend violence as a political tool.
A lot of veterans I speak with still see the purpose of it regarding defense, because unfortunately there is a lot of evil out there. I was wondering if you could talk about that a little bit, if you see a purpose just defending ourselves against what's out there.
There's bad people in the world. Always. There's always going to be bad people, not just outside of our country, but inside of our country, who attempt to inflict harm on others. And self-defense is a sacred right. Every human being needs the ability to defend themselves and to assert their own rights. And I think that we should definitely keep that door open. We shouldn't ever say that we're going to let you roll over everyone in our country. But the way that we perpetrate war right now is not defense. The Department of Defense doesn't do any defending. They attack and they destroy. So now we have to try to teach society to overcome that impulse, the impulse to grind out anything we don't like in the world.
Yeah, and this is a bigger conversation, but it is, we're catalyzing the thought process and the feeling around it now. So, thank you.
Hi, I don't know too much about Hinduism, but I do know that part of the Bhagavad Gita's philosophy was developed on a battlefield. So there, in my mind, there's a spiritual place for what a warrior could be. Could you guys elaborate on some of the values that you can bring to civilians in fighting, say, the drug war?
Go ahead.
Yeah, I'll give
Go
it.
ahead.
So I just want to say that what I've found through my work is that the only strike first force weapon you have available is vulnerability. And
Love.
yeah, and because that creates a safe place, it's basically like, the salute came from basically, I'm not going to fight you because I'm putting my hand on my helmet, so I can't be putting it on my sword. And it's like creating a safe place where you're disclosing something about you that could be attacked or be viewed as weak, but you're willing to have that courage to put that out there. And then that's a place where then somebody else can contribute as well, and you can have that safe healing space. And that's really what we can do as warriors, is show people that it's okay to be vulnerable and it's not going to be the end of you.
I also,
Thank you for your service.
I just want to piggyback on that and mention that there's an old proverb of a Chinese student says to his master, you talk of peace, but you teach me about fighting. And the master says it's better to be a warrior in a garden than a gardener in a war. And it's very true. If you know how to fight, then you should naturally feel less inclined to actually get in one. you know what the consequences are, you know how horrible it is, and you don't ever really want to go there unless it's absolutely necessary. And I think, I guess the United States has sort of lost its way there and become a bit of a bully, and we need to rein it in.
Morning. Thank you for speaking with us. I was wondering if you could speak a little more on your experiences with cannabis. I left the Marine Corps 2 years ago as well, and in my experience, I've been able to use psychedelics in a respectful manner, but when it comes to cannabis, it became more of a thing just like alcohol or promiscuity or something else, another escape, you know, some sort of addiction. And so I'm curious to see how y'all were able to transition, coming from very similar situations, to not use it in that manner.
I think initially for me, when I first started using cannabis to come off the opiates and help come off of the plethora of medications that I was on at the time, it was useful to help combat some of the withdrawal effects from the opioids and whatnot. It helped me sleep, this, that, and the other. And now I find that if I'm getting really angry and I don't really know why, there's just this kind of, you literally wake up and there's this beast inside of you that's mad, and it is really mad. Those days, because of the medicines that I've done, I'm more aware of the fact that I wake up like that. I will literally look at him and be like, I don't know why I'm angry, but I'm really angry right now. And the first thing he'll say is, do you want me to roll you something? Okay, so I understand what you're saying as far as the self-medicating with it, but I also look at it from a standpoint that what is, getting high, so you're feeling better, you're elevated. That's not necessarily a bad thing. And I don't really see, there is medicinal and recreational, I get that, but truly it's all medical. It's all medical when it comes to cannabis. It's, you use it to help your depression, you'll use it to help your anxiety. This is a non-toxic plant. Compared to everything else pharmaceutically you could be given, this is the safest option that you could use.
Right, and I agree with you on that, but I guess what I mean is I found that I would tend to use it, like I said, as an escape. Instead of dealing with these things, instead of feeling these sorts of things, I would use it as an escape, and then I can go to sleep or whatever, and the next day I have not dealt with anything. I've still just used it as an escape.
What were you escaping from?
I mean, whatever.
No,
Yeah.
well, you were escaping from something. You were hurting from something that you needed to avoid. You needed to escape. So you were using it as a medicine to soften that pain.
Right.
You were still, even though your ego is telling you, this is terrible. I'm addicted to this. I'm confused, and this is horrible. I'm going down a horrible road with this. I feel that in large part is societal conditioning towards that. I mean, let's liken it to another stimulant, coffee. How many people wake up in the morning and, I mean, it's the meme of the hour, I can't people until I've coffeed. Well, okay, so what are you using that coffee to medicate? There's caffeine in that. Caffeine has an effect on how you view the world.
For sure.
And so, you can be just as addicted to your cup of coffee, but you don't hear people crying out about coffee addicts needing to go into clinics.
Oh, and I'm not demonizing it.
Yeah.
I'm
I'm not
curious to
saying
see
that
how
you are.
y'all would transition from that. Because
Absolutely.
Just like alcohol or anything. it's-
Absolutely. For me, I used cannabis extensively. I was dabbing concentrates, 6 to 10 times a day, going through a gram of wax a day, but it was to keep my anger and rage and anxiety in check. And when I started to feel that it was more of a hindrance to me, I had the perspective that it was a hindrance to me. I had that ability. And it's one of those things where I started listening to my body and that gut instinct saying, hey, maybe this isn't serving you. Maybe this medicine needs to take a back seat to something else. And that's when I started, that's when I found ayahuasca. And that was the next step in my healing. It's that, what is at the core of what are you using it for? What are you hiding from? What are you pushing away? What hurts that you're having to numb out with it that's making you now feel that it's addictive? And then once you can identify that, then you can begin to work on that trauma, and the cannabis can take a back step because that medication is no longer needed. Does that?
Yeah, I agree with you. Yeah, that's a great example. I appreciate that.
I actually sympathize a lot with your predicament because when I got off all the pharmaceuticals, 20 different pharmaceuticals, opioids, benzos, neuroleptics, anti-seizure medication, you name it, it was out there, and it was in me. And after I came off the medication, I was still using cannabis at excessive rates. And I did start to realize that maybe it is getting in the way of my interactions with the world a little bit. And that's also when I found ayahuasca. Myself and Mike Cooley, we took ayahuasca for the first time together. And not but a month after that, I undertook an ibogaine experience. And that helped me to renegotiate my relationship with every single addictor in my life, including just behavioral addictions like Gabor Mate was talking about. It's not just substances. It's PTSD itself is a kind of behavioral addiction. You are doing things that have served you well in the past to keep you alive, but they don't serve you anymore. They're getting in the way. And that's the definition of an addiction. When something becomes so prevalent in your life that it becomes to interfere with your interaction with life, then it's an addiction. And honestly, psychedelics can be like this too. The people that go back and seek it again and again are never bringing anything back and trying to do the work in the everyday life, reintegrate it into their behavior and into their mind, into their hearts, into their soul. They don't get anything from it. But if you do the work, then you'll succeed.
Thank you.
All right, we're over time, but thank you guys very much. This was
Thank you.
awesome.
Thank you.
Thank you.